Thursday, February 28th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I'm joined as always by
JJ Hodshire, President, Chief Executive Officer.
Who is also now a 2024 Rural Hospital CEO to know, according to Becker's Healthcare. So you didn't know I was going to throw that in there.
I did not know you were going to throw that
congratulations.
Thank you. There's
JJ,
only two of us left in the country, but I made the list of 3, so I'm very excited.
And this is a repeat for you. I can't remember if this is your, I think this might be your 3rd time to make the list. So I'll have to go back and check and confirm.
All right. Well, thank you,
congratulations.
Rachel. Thank you very
to
much.
For that.
Appreciate your kindness.
And also we have a special guest today.
We do. A good friend of mine, a good friend of the hospital, of our community, is delivering exceptional care here at Hillsdale Hospital. Many of you know him. You may have seen him at ball games, church events, or you may have actually had him as a provider.
Or seen him here on Facebook Live, because you were one of our earliest guests. You were with us when this room was half the size.
That's true. Yeah, it's true. It was a fun time.
We barely could fit the table in the room, much less ourselves.
So it's great to have with us in the studio today, here joining us live, Dr. Brian Sinischo, also our chief of OBGYN program. So he serves a very important role as a clinical leader here at the hospital, but he also provides amazing care. Get many comment cards every month about the care that this guy delivers to our patients, to our families, and bringing new life into this world. I'm excited to talk to him today. Excited to have you in the studio. Thanks for joining us.
Thanks.
Great to have you.
So why don't we just get started with you kind of sharing your background, and because we know you didn't actually start your medical career in OBGYN, right?
Right, yeah. So I have always grown up in Michigan, lived here, and then I went to Michigan State and became a paramedic while I was doing undergrad, and worked in 911 for 4 years, and then critical care paramedic for 3 years, and while I was finishing my degree in biochemistry and molecular biology. Then
that sounds really hard.
It was super fun.
Yeah. Just pick that up on the side. Yeah.
Building protein structures. With computers is what the whole thing is.
Wow, I love protein shakes.
What language is that again?
Computer.
Computer. But during that process, not only were you studying and doing all of that work, you were working.
Yeah. So I worked a
incredible
schedule. It was either 72 hours or 48 hours every week while I was in undergrad. So it took a little longer. It took me a while.
And you were working as a paramedic.
Yeah.
And that's a lot of, that's rigorous.
It is. Yeah. And emergencies.
24-hour shifts.
Right. Yeah. 24-hour shifts. And then sometimes they're 72-hour shifts.
Yeah.
Because if you pick up in the middle, then then you're just going straight through.
Wow.
So when I got into medical school, I was ready to not sleep ever. And
yeah. Pretty much.
Like 7 years.
That's kind of like regular, right?
Yeah.
Well, obviously you landed here, and we've had a great opportunity to introduce you to the community. And, I think if you were to summarize your career here, I think it's been good, hasn't it so far?
Yeah.
A lot of great things that are happening that we're going to talk about today, though.
Yeah.
I'm excited to talk about some of those things.
Yeah.
So talk a little bit about the uniqueness of Hillsdale Hospital's birthing center, because everyone knows my obsession with their birthing center. I love it.
Yeah.
Also saved my life in there. So I believe next week maybe are going to be talking about that with Hillary. We'll have her here and talk about that story. But talk a little bit about the uniqueness of not only what we provide here in our community for our patient population, but also our capabilities, because we are much more advanced than even some other clinical folks have expected us to be, and have been surprised by what we are able to do.
Yeah. So we have a team of 3 OBGYNs that deliver babies. Dr. Spencer, Dr. Odell, myself. Rachel McCormack is a nurse midwife who also delivers. And then Alyssa Hartley is a nurse practitioner that works in the office. Mm-hmm. The 5 of us are seeing patients regularly and making sure that their health is optimized to be able to give birth in a healthy way. We are supported by an amazing group of MAs in the office, and the nurses on OB, the surgical techs, the nurses in the OR. All of these people come together to give 24/7 care that is outstanding. Dr. Ellis is our pediatrician that I don't know what percentage, 90% of the babies, 95. Yeah. She knows all the babies, takes care of all the babies when they're early, when they're sick, when they're doing great. She is an amazing asset. She also has a team that she's built of nurse practitioners that are outstanding. Our little hospital has the ability to do a C-section at any point, to get anesthesia, epidural, spinal, sometimes, unfortunately, general. We've also had to go our blood bank. You hate using a blood bank, but hemorrhage, shoulder dystocia, all of hypertensive emergency, our team is trained and ready to take care of patients. There's a Bakri balloon. We just have a Jada that was added. New technology that is used to help with hemorrhage. We're up to date, and we keep changing protocols from the nursing side, the physician side, our nurse midwife. Everybody is teaching. That's another thing that we do is the University of Toledo sends medical students here, and each of our nurse practitioner schools in the area, we have students coming here even as far as Kentucky, and they rotate with us to learn about women's health. And women's health in rural America is not easy. We sometimes don't have the resources of bigger places, and sometimes people can't make it. But we do make medicine work, and we take care of a lot of people here.
Yeah, we do. So let me ask you a question. The function of your office, it's really dynamic. I mean, if my wife was to make an appointment with you today, it doesn't necessarily mean that she's going to see you. Can you explain two things? Number one, I may not be giving birth with you.
Right.
You may not be there.
Right.
I want that to be, a discussion point for us. But the second issue is, once you talk about that process, I want to talk about the throughput of our patients in the clinic. Because why would a nurse practitioner see someone and you would see someone?
Sure.
So can you talk about those elements in any order you want to do that?
Okay, so this morning I am off call. I was on call until 7 a.m. Now I'm not on call. 9, my patients start. I am supposed to be there at 9 o'clock. Dr. Odell was in the OR, and a baby decided, they always do, they don't follow rules. They're like, oh, you thought you had a plan. That's so cute. And then they come out. So Dr. Odell was doing surgery with Dr. Ellis, because I don't know many pediatricians that also scrub.
Yeah.
But of course, she's in on the C-section.
She's amazing.
Yeah, that's what she does.
Yeah.
And so they were both tied up. So I ran from the office and delivered a baby, got the placenta out, took care of all the stuff, and then got back. But I'm a little late to my appointment. So patients, we definitely want to see them timely. But because it's rural medicine, this is one of our most difficult things, is making sure everybody's seen and in a timely manner. So we do a lot of apologizing. Because we want to see everybody. We want to take care of everybody. But the babies dictate. But we want everybody to know we will be there when it happens. We will be there for them, whether it's the person you were going to have or somebody else. So we step in for each other. That being said, some of those patients, they were supposed to see Dr. Odell or myself, and we had to step out. So Rachel or Alyssa may pick up and say,
versus canceling it.
Right? Let's not cancel. They're already here. They had to get childcare, or and they interrupted their life. So we try to take care of them. Another thing is you can call and request somebody, and they can set an appointment up, and they can say, I want to see Dr. Sinischo. I want to see Dr. Spencer. Most people want to see Alyssa because she is one of the nicest people I've ever met. They also want her to deliver their baby, but she doesn't do that.
Right.
So she's constantly apologizing. I'm sorry, I didn't do that. So as a team, Rachel moves her call day around and delivers babies, and then the three of us are on call. So when patients come in to deliver, who is on call is who is going to take care of them. And the caveat to this is, because there are patients to see in the office, it is nice to not be on call on the days you see patients, because then they're not being canceled. They're not having to reschedule. It is that is difficult, because the patients love that relationship with them, and they want you specifically, but it is difficult just with schedules but
it's a true team approach. I mean, it's collaborative care for a team approach of providing care to that mother and to that family. So I think that's critically important that we're accomplishing that. Now, I mean, and
I would say as a patient, there's actually a great benefit to seeing the other providers at some point during your pregnancy, because I saw all 5 of you at some point during my pregnancy. So that way, based on whoever is on call, it's not someone you've never met before.
Right. You have an introduction
you know this
to them.
person.
And in research, it shows patients' anxiety and stress decrease by knowing everybody. And it is really nice. We've had recently Coldwater Hospital close, and there were patients that came in at 36 weeks, 38 weeks, 39 weeks, and they're
ready to deliver.
And so you try to get them to see as many, but there are times when this is impossible.
So if you were to look at today, if someone was to ask you what's happening in Hillsdale County for women's health, for what are the main concerns you have among your population, health related issues are you seeing right now.
Right. So obesity, which drives many metrics, diabetes, hypertension. This is specific in pregnancy. The patients that don't get care. So we kind of separate our job into almost three. You have pregnancy care, and then you have like premenopausal care, and then postmenopausal care. And even though they're annuals, it's treated very differently because you are concerned about different things in health. So whether you're talking about bleeding issues, birth control, annual exam, handling blood pressure, cholesterol, all these things. And then in your postmenopausal patients, if you have a bleed, if you have any urinary things, fecal just a lot of issues that you can go, sexual health, being not uncomfortable. A lot of it is mental health as well.
Yeah,
a lot of untreated depression, anxiety, and we do have resources locally, but we are understaffed, and we spend a lot of time with counseling and working on mental health.
Yeah, we do. Yeah, we do.
So what would you say is misunderstood in today's environment about OB-GYN care, but specifically hospital-based deliveries? Because there's a lot of rhetoric and a lot of information and quite a lot of misinformation out there about the experience of delivering your baby in a hospital.
Right.
And, you know, I've delivered in a hospital in Fort Wayne, and then I delivered here. But I can say that our facility really doesn't fit any of those negative stereotypes of what people expect.
Right.
So what do you think are some of those misconceptions that you hear often from your patients as concerns of like, I don't want you guys to make me do this, or I don't want to have to be in this position or make these decisions or whatever it is? What are some of those things? And then what's the reality of those situations?
Right. So shared decision-making is what we always want. We want to educate patients and then allow them to know the information. So sometimes patients feel Pitocin is a terrible medication. We routinely give Pitocin in our protocol after a delivery to reduce the risk of hemorrhage. To give that, usually you need an IV in. And an IV, some people are like, I don't want an IV in my arm. What's difficult to explain is hemorrhage is the thing that has killed most women worldwide with delivery. Our rates are lower in the United States, and it's because we do things like IV and use Pitocin. But these are decisions that our protocol is to get an IV in, but the reason is it saves lives.
Right.
It's not us trying to take away somebody's autonomy. Our birthing center, we are not interested in putting patients in a bed, strapping monitors on them and leaving them there. We have birthing balls. We have the bed turns into a chair. We walk the hall.
Whirlpool tub.
Whirlpool tub is
Highly
unreal.
recommend.
Yeah,
It was amazing.
All kinds of ways to labor and to deal with pain that are not just medications. We do have medications. We do have epidurals. We can do all of the things that larger hospitals can do, but our nurses have trained in being a doula. We are also doula friendly, where you can bring them in. So we try to make the experience for moms to feel as supported as possible. Right. Sometimes there's visitor restrictions, which you would like to have 4 people in the room, and right now we can only have 2 because of influenza, COVID, all this stuff. But we really try to make a mom feel supported and know that they can make decisions and autonomous for themselves while being educated. Hey, Pitocin may be recommended so that hemorrhage can be taken care of and not make you sick.
Right.
So some new programs, new opportunities that are coming forward. I don't know if you want to talk a little bit about anything that we're doing, but I think there's some exciting stuff happening.
Yeah. So centering pregnancy, Dr. Odell, Rachel McCormack, Hillary are working on a program with many other people that, statistically speaking, is the best thing that we can do to reduce maternal and infant morbidity and mortality. Moms are given much more ability to care for themselves. They're weighing themselves, checking their own blood pressure, which sounds like, well, you have MAs. Why are you guys being lazy? But in research, it shows that when a mom weighs herself, writes it down, when a mom checks her blood pressure, it decreases her blood pressure. So something about the power of the mind, when you empower patients, it just makes them healthier. So that is an amazing tool that we have. And the funds for that were we had a nurse that went to get her master's degree, and that was her thesis, was to get us resources. And it was a super cool thing. She's now on to a different job, but she has left that for us to be able to help our patients.
Yeah, that's going to be incredible. And as we look at, rural medicine, especially in your area, it is a challenge to be able to deliver those services. And so, if you were to give some advice, as a pregnant mom out there today who's not coming in for, what can we say to them to convince them how important getting to their OBGYN is?
So there are things that can happen that you don't feel. You can have high blood pressure. You can have high blood sugar. You can be pretty sick and feel absolutely normal, because young people don't show signs. Really, nobody shows signs of high blood pressure unless they have a stroke or some kind of an emergency. And treating that well before that occurs keeps them safe and the baby safer. So I would encourage people to get care as soon as possible. Also, dating an ultrasound. Sometimes people have irregular cycles or they miss the cycle. And so getting that early ultrasound before 9 weeks really gives us the best way.
And that's the most accurate, right? Because you would think, I think a person who's non-clinical and doesn't understand how any of that works, I'm talking about myself, you would think that, the later in your pregnancy you are, the more accurate that would be. But it's actually more accurate early, right?
It is, yeah. 8 weeks and 6 days and before, you're within 5 days. Then 7 days until 15 weeks, and then 14 days. And then actually, if you're dated from a 28-week ultrasound, you have a 21-day. So that's a 42-day window of accuracy.
Yeah.
It's always a pleasure having you here on Facebook Live. There's so much that's happening in your world.
It's not Facebook Live anymore.
That's right.
Because if you folks will remember, we are now on YouTube, LinkedIn,
and
Facebook.
We are live.
So, yes.
It's great to have you live. It's great to have you live. It's really encouraging the work that we're doing, but none of this would be possible without you and your team. So I want to thank you. It's, to come to rural communities like Hillsdale, it's a commitment. Uproot your family. It's a different way of life. And I want to thank you for your contributions, not only in the world of OBGYN, but also as our leader. That's very important, the leadership that you provide to our team. So thank you. I really appreciate the work you've done. Kirsten, are there any questions from the audience?
No
None. You've answered every question. That's awesome. So to close, we want to thank you, our listener, for your participation. What we do here every day is made possible because you support the services. When we say Hillsdale Strong, Hillsdale First, that happens because you place Hillsdale first in making them a priority, us a priority in the care that we can deliver to you. So when you think bigger is better, it's not true. We're delivering amazing care here at a lower cost and many times higher quality. And we do that because we want to ensure that you, our consumer, our patient, our customer, have access to a full continuum of care. That only happens when you use us, because the more that we have of you using our services, the ability for us to expand services now increases significantly. For example, offering programs happens because we have a larger volume of patients coming through now that we need to take care of. Ensuring that instead of going to another community to get your joint replacement, that you can go to our board certified orthopedic surgeons, some of them double or triple board certified, teaching hospital for the University of Toledo when their fellows come here to perform surgeries. This is pretty incredible what we can offer this community. Neurosurgery, Dr. Logan Nathan, Dr. Alam, vascular surgery, pediatric ophthalmology, all the things that this community brings to you is a result of you trusting us and using our services. Just so to think, I have to go to this particular clinic or to this university hospital, that's some pretty dangerous thinking, because what will happen, your hospital will eventually close. And we watch that happen in communities like Albany and other places. Now we're strong and we're viable. How is that possible? Because you have trusted us with your care. And so we want to encourage you to continue to use our services. When you use Hillsdale, we become Hillsdale Strong when you place us first. So thank you for doing that. Other opportunities and ways that you can support us, think a hero. Reach out to us on Facebook, reach out to us on any social media platform, and just thank your healthcare provider. If you live beside a healthcare provider, if you live with a healthcare provider, thank them. This is a very rigorous and a very tough job. If you're looking to join a winning team of healthcare, look no further. HillsdaleHospital.com is a website you want to go, because you can find top jobs. Right now, we have 28 open positions in which you can apply. Some of them entry-level jobs in which we can train you. We send people to go back to become nurses, physician's assistants, nurse practitioners, pharmacists, CRNAs. We've done it all. if you're looking for a career, this is a place that you can look. If you want to listen to other programs like this every week, WCSR 92.1 every Friday, we talk about this type of environment, what's happening in Hillsdale County in rural medicine. That's on a local radio station, on Facebook Live, on Twitter, on all of those platforms. We reach a bigger audience. One of our largest audience comes from our podcast, Rural Health Rising. So wherever you subscribe to get your podcast, Apple Podcasts, whatever it is, we would ask that you subscribe to Rural Health Rising, because you subscribing helps us get the message of rural health sustainability into the future to the rest of this country. So we want to thank you, our patients, our friends, for your support, your loyalty. It means so much to us. And we hope to see you here again next week. Until then, stay safe, stay healthy, and stay Hillsdale strong.
And we think we're clear.
And we're
We think we are. We don't know. We're pretty sure. It says
All
it's
right.
loading. So if you're still seeing us out there on Facebook Live,